Teresa, and I will be presenting today, but I'm double duty as the moderator as well. So first I want to introduce our presenters today. Teresa Nguyen is from Colorado. Can you guys see okay? Because there are a few more chairs up here if you'd like to come on up. Unusual that they do a presentation room with a pillar right in the middle of the room. I think that's an engineering faux pas. So our presenters are Teresa Nguyen and Mallory here. Teresa comes from the state of Colorado, and we met Teresa when we had, through our first integrated systems grant, our D70 grant, we had a youth advisory council, and Teresa was a part of that, and that's where we met Teresa. And she has since just kind of stayed on with us as a consultant in Colorado, but also works as a consultant with the National Center of Got Transition. And then Mallory Sear, who's from actually the state of Maine, but is now, they're both MPH students. And Mallory started, she's been doing advocacy and systems change work for over 8 years now. We'll be finishing her MPH at Boston in May. Woohoo! Woohoo! So excited about that. And just looking for work. So if anybody has any work for a young, incredible MPH leader.
Preferably in a warm state. Not big.
So their official bios, I believe, are in your book, but you'll learn about them and with them as we go. My name's Eileen Forlenza, and I also am from Colorado. I work in the Title V agency. I have 4 kiddos who are all in the transition age. My second oldest daughter, Holly, is 25. And I've been doing work on her behalf for many years, and our transition planning is not going well. And so that's what we want to talk about today, is just what do you need, what are the skills, how do we tell a story about this that really changes the way we do business, and that's kind of the intent for today. Did I miss anything? Anything else you guys want to add about yourselves? Other than that you're really awesome and great. Okay. So what we know from talking with families across the country is that people just want to know, why is transition important? Who should be at the table to talk about this? What are some effective strategies? What's the how? What's the why, when, all of those things. So we wanted to make sure that this session really addressed what are some of the more tactical ways, and what are the conditions by which. Can we turn this down? And I don't really personally need it unless you guys lay it out. So what are the things that we really need to make it work? And how do we blend that with some of the narrative? In all of the work that I've done with families and youth, we always like to say that stories are the food for change. It's narrative that changes and that creates social justice. And that when people begin to share experiences, that's how the system then responds from a quality improvement perspective. So I would love if you guys would please turn to the person next to you, in either 1 or 2 people, and share, why are you here? Why, with all the things that you have to choose from at the AMCHP conference, why are you here to talk about transition? So if you'll take a few minutes and talk with the person near you, that would just come on into the family room. Just come on in. Come on in. We want you to be comfortable. We want to have this conversation about transition because it's so important. And if at any time you have a comment or a question, please ask. We're in the family room. It's cozy, it's quiet. Unless there's any question, I am wearing my Bronco orange. Sorry. They did falter greatly, and you know. Mallory made it very clear that she's wearing her New England Patriots blue. I resisted from calling her a cheater, but we'll talk about that. Teresa likes to stay neutral.
I'm neutral. Nothing but love here.
So thank you. I hope that talking with your neighbor helps you see, again, it doesn't take long for us to talk with each other and realize this is an issue that needs to be spoken about more and with more intention and with the level of passion and concern that we have. And for that reason, that is why the Bureau, the the Maternal Child Health Bureau, has funded a national center on transition. And the National Center on Transition, we call Got Transition. And we have our representatives from Got Transition here today, Peg McManus.
Yes, and Nicole Goebel.
And Nicole.
And our funder, Marie Mann.
And Marie Mann, thank you. So we have lots of Got Transition folks in the room, and we want to be accessible to you at all times. Myself and Mallory and Teresa, we're also consultants to Got Transition. So, Mallory, take it away.
So, one of the biggest questions that we get is, why is transition important? And I think that within this room and within this conference, we as MCH professionals, we understand the barriers to healthcare. We understand that the system is challenging, and we understand that health is a priority. That's why we're all here. But for young people, sometimes it's hard to get that message across, because for any of you that are young professionals that are in school, or for those who have children who are facing adolescence, you know that it's pretty much the last thing on their minds. I have a lot of young people that come and talk to me, and the questions are about, how do I get a job? How do I move out of my parents' house? How do I find friends? How do I find a boyfriend? How do I go on spring break? Like, all of these things are what young adults want. They want housing, they want jobs, they want friends. And what we here at Got Transition really do is to help young adults understand that in order to achieve all of those things, you have to maintain your health. And I think Teresa and I can both speak to, sometimes you have to learn that the hard way, because a lot of times the health piece can sort of, you know, fall to the wayside when you're pursuing education and employment at the same time. But because of this work, you know, it's something that we really understand and try to get across to other young people. You know, people will say, well, I have a disability, I don't have special healthcare needs. And we always try to say, but you have health. Everybody here has health and wellness. And in order to do our best work every day and maintain our relationships in a positive way, you need to maintain that health. So that's really what we're here to emphasize, and to what Got Transition as a national center does to help young adults feel empowered about maintaining their good health.
Can you guys hear okay? Would you prefer she uses a microphone? Can you use the microphone? Because I think it's tough in the back. Okay. You ready for the next slide, or do you have a comment, Teresa?
No.
Okay, so how do partnerships impact transition? I have a very unique perspective, because both of my parents actually immigrated here from Vietnam, and as a child in a multicultural family, I am parents who actually don't speak any English. I had to start navigating all of these different systems at a very early age. I don't know if that's the case with many, many youth out there. I think, and so I think that's the key point here, is that preparation is key, and these partnerships really do make a difference. So I have a quick story. Eileen loves the story. My undergrad was in physiology, and I took a cadaver lab, and I was really excited. And I really wanted to work with dead people. I don't know. And
I won't be offended.
yeah. And the tables, I'm sure some of you know, are very, very high. And my wheelchair at the time did not have the fancy seat elevator it has now. And so I knew ahead of time that this was going to be a challenge for me. And, you know, I communicated this with the department, with the university. But long story short, little did I know the most useful partnership that I formed on campus was with the theater department. And theater and physiology don't really go together. And so I didn't find this out until the very end of the whole spiel. I was told to not take the class. That was an option. Or to just they'll give me the credit. That was the other option. Or I could watch by video, which I was not going to do. I was really excited, oddly, I don't know, to work and get in there and touch the cadaver. And so after many conversations, the theater department came up, and we came up with a solution with using their stage lift that they use to get people who use wheelchairs up onto the stage during performances, and I just kept this lift in the classroom for the semester and participated equally with my peers. But that's a pretty random partnership, but it impacted my entire education. And so that's just one example. Partnerships with your healthcare providers are important. People even, I have a really good contact with my local Medicaid office. I think that's really useful, especially when you're trying to navigate the systems. And of course, your PCP, that's a huge partnership. To be able to communicate and really understand why both of you are there, why the doctor is, trying to implement this transition process, and why it's important for the youth to really go through that. And the parent.
Well, the parent will. So as a parent, I think, our experience is a little different because we're in that dual role of wanting to empower our kiddos and do as much, empower them to exercise their full independence. But in the case of a lot of our young people, they're not able to do that on their own. My daughter requires 24/7 care, is nonverbal, has all of those kinds of added needs, and cannot literally speak for herself like these two can. And so when we talk about the role of parents through transition, it's a similar but different conversation. But the partnerships are the same. As Mallory and Teresa have both said, just working with all the partners that are going to be a part of the transition planning, the specialists, the PCP, the community, the schools, all of that. But parents I have found, working with so many parents across the country, there's an added level of the grief cycle that we go through, and that there's this milestone where they should be graduating from high school, should be getting a job, should we be going to college, and you're looking at all the things that aren't happening, and so our grief cycles come up. I was talking with a parent just last month, and she explained it to me that she has like bursts of grief, and she called them grief bursts. And it's all these things that aren't going to happen, and yet she's still in the game. And she still knows that as she's the voice she has two kiddos that need her support in transition, that this is really a big part of her role. So you want to keep that in mind as well. You want to touch on that?
So within this session, we have included several materials. Is this on? Is this thing on? Sorry. That have sort of framed our conversations throughout the years. And one of those things is what we call a top 5 that Eileen and I have both created through earlier generations of Got Transition. Because we started realizing that in these presentations, we were sort of sharing the same lessons that we believed were important. And so we decided to just create a short list from the parent perspective and from the youth perspective, things that we really thought that if nothing else should be taken away from these presentations and really understood as cornerstones of transition. We also are sharing other resources with you. But we just want to run through the top 5 really quick. And these are things that I came up with based on my own experience. The first thing is understanding the difference between strength and deficit-based language. For many of you, you may understand that when we're navigating the systems within healthcare, Medicaid, obtaining coverage. Wrong list. Sorry. The biggest thing for young adults is to understand your condition and your health needs. That's the bottom line. If nothing else, have the young adult to the best of their ability, understand their condition, and be able to share it with other people. And the biggest thing is having confidence that you are the expert. Because a lot of times providers may not take your word for it, that you are the expert of your condition, but having the confidence that you are. One of the biggest lessons that I learned through my own experience is being able to ask for help. a lot of times as young adults who are champions in this field and trying to speak on behalf of other people and do all these things, we sometimes feel that we have to do it all, and we can't all the time. And being able to identify who your support people are and ask for help when you need it, so that you may prevent a health emergency or falling behind in other ways is really important. Being able to accept that support and trying to find new ways to take responsibility, even if it's something that you may not have thought of before, being open to those different suggestions from parents, providers, and other support people. Broadening your circles of support, and I think Teresa's story about connecting with the theater department is a really great example of thinking outside the box. We automatically think, well, my PCP is who I should go to for this, or my mom or my caregiver. But sometimes it's connecting with somebody else who can give you that support to overcome a challenge, or may be able to provide a solution that mainstream providers might not have thought of, because it's not the way things are typically done or typically practiced. And the final thing, again, is being able to think outside the box in terms of transition. One thing that my family always preached when I was growing up was it wasn't about no you can't, it was about how can we, and not letting that diagnosis rule your life. When I was growing up, I did a lot of things that people never said I would be able to do. We took vacations, I went to prom, I had sleepovers, and living with a chronic medical condition that involved nightly IV infusions and a lot of monitoring and being aware of different things, at first glance, it wouldn't have been something that I could do. But I had a very typical childhood and a very normal young adulthood, I like to think, and I think a lot of that is contributed to the way that my parents and my family really supported me to be a part of those normal activities, even if we had to do it a different way.
Great, thank you. So on the parent side, again, this is a compilation of working with Got Transition and hearing from parents from around the country. And that was, I think, that really exposing your kids early to this process. We know that in the school system, there used to be the education requirement was that students at the age of 14 would have a health transition plan. That's now been bumped up to age 16. So for some kiddos, if they're in a foster care system or another system whereby their independence is promoted at age 16, we're going to lose some kids. So we always talk about starting early at age 10, 12, 13. And some of that is like, one of my great mentors, Patty Hackett, used to always say, at what age do you let your kids order in the drive-thru when you go through the drive-thru? It's the same concept. At what age do you let your kids start filling their own prescriptions? They can do it. It's on the touchpad. So getting kids early on really understanding how they can be wise healthcare consumers. And again, for those of us who have kids that don't have the ability to do that, it's still speaking it and talking about it. And for those of us who have kids that don't have special healthcare needs, it's the same concept. When we're planning for our kids to go off to college, it's the same kind of idea. So start early and be relevant with that. As a parent, I've always tried to really understand the difference between health and healthcare. There's a lot going on right now about health and wellness. And are we promoting for our youth with special healthcare needs to look at their health and well-being? We know that, for example, the National Office of Special Olympics decided to do some health screening at their national, did you guys know that? That the Special Olympics is starting to do health screenings at their events? Amazing, you should check it out online. They had incredible outcome data, which was not good in our favor. High rates of cholesterol, high rates of oral health that was not good. Obesity rates, and these are athletes who are working within their disability for this competition, but their health screenings were not being managed well. So there's another data point if you want to look at that. That's another integration for you in your state to connect with your Special Olympics. But just to really understand the difference between health and healthcare. We know that the healthcare visit itself only predicts 10% of the overall health and well-being of a person. Everything that happens outside of a healthcare visit is what determines our health and well-being. So don't get too caught up in the healthcare piece, even though that's a big part of our conversation today, because we want to talk about creating this concept of health and wellness beyond just the healthcare setting. These handouts, by the way, are part of what was uploaded, so you can have access to this, and we have a couple of copies. Looking at being proactive, who's a part of the healthcare team, your medical home team, I always look at it. The PCP is often known as being the quarterback of the team, but who else is on the team, what's their role? Sometimes, again, it's the camp counselor, sometimes it's somebody at the church or in the faith community who's doing a lot of activities socially. Our kids tell us over and over and over again that the reason they're not fully included in social opportunities because there's something about their health maintenance that's getting in the way. Sometimes, what it take you guys an hour last night to find a cab because of the mobility, that's an issue. So sometimes just socializing on an everyday kind of activity, there are barriers in place, so to just be mindful of that. Knowing that having your critical information insurance cards, I give all of my kids their insurance card when they're about 10. And keep it in your backpack. Oh, but they'll lose it. Well, make a copy and laminate it. Over and over and over again. Always have the kids understand that healthcare is a transaction. You give and you get. Healthcare is not free. And this is a big dialogue in our country right now. And our children and our youth need to understand that the healthcare system costs money and that they can learn how to be a consumer with that. Because with that comes empowerment. And so teaching kids very early on about that whole process and what their insurance card really gets them. And then understanding, again, the partnership and how critical it is to have a partnership. We talk all the time about how are we doing family engagement? How are we doing youth engagement? And I will shout from the mountaintops, when we shift from servicing families to partnering with families, we will see change happen in our country. So when we partner with families on the health and wellness of our kiddos, that's when things will change. And when we partner with our youth, instead of looking at this as a service delivery project and a service delivery, that changes the dynamic just a little bit. Does that make sense? Do you feel the difference in partnering versus servicing? It's really important. And lastly, one of the things that Mallory started to talk about was that as a parent, I think one of the hardest things for me during transition was when we go from the child-centered, the pediatric system is all about you are entitled to a free education, right? The entitlement programs that are available for children, especially through the school system, are abundant. Simply by their age and the fact that they're in our public school system, they are entitled to blank, blank, blank. When you shift to the adult system, game off. When you shift to the adult system, it's all about eligibility. And as a parent, that's really hard because you know what happens? To become eligible, one has to be pitiful. One has to say, my kid can't do this. She can't do this. My kid is still in a diaper. My kid can't do this. That's hard. That's hard. I don't like to talk about my daughter and all the things she can't do. I'd rather talk about the fact that we celebrated, that we got her out of diapers when she was 16. I want to talk about that. But if we talk to our Medicaid caseworkers about the things that they can do, the benefits package gets minimized. So parents, I'm here to tell you, go through the grief cycle and don't define your young person by the things that they can't do, but I'm sorry, you have to play the game. You have to speak in deficit language in order to qualify for adult services. If you only speak in strength-based language, you're not going to get it. And that's why I say from the tops of the mountain, for parents to understand, you have to be bilingual in this way through transition. You have to be able to shake it off. Oh, Taylor Swift, shake it. You have to be able to shake it off and say, I know that my kid is all of these things and I need a CNA for 8 hours a day. Or I need to delegate the nursing responsibilities at certain times. And we've got to be able to talk about what we need. Because in the eligibility world, that's the only way we're going to get it. And I know we don't have time. Mallory and I have done a presentation on being bilingual through transition, and so we can't go into detail now. But Mallory and Teresa will both tell you that they've had visits with their caseworkers where they've put their iPads and their Mac computers away because they needed to look more pitiful to get the services. And that's the game we do. It's not really a game, but it is the reality of how we do that. I get a little animated about this. So the who part, Teresa, is that you?
So this is really personal to me. I think it's really important to consider who is part of the team when transition happens. And it's important to recognize the youth in this role as beginning to make decisions for their health. And I think it's hard for a lot of people to do that. It's hard for the primary care providers to really recognize that, and it's hard for parents. And it's hard for youth to really think, oh my gosh, can I make that decision by myself? And so that's really important to kind of really define those roles. Again, I started really early, and so my role was very confusing. I interpreted a lot of my appointments at the age of 13. And so I really did make those decisions very, very early on. But nobody told me, okay, you are the decision maker now. It just kind of happened. I think I would have felt a little bit more comfortable if somebody just said, this is your role now, and, you know, take on this responsibility. And I think, as Eileen said, it's terrifying for the parents. And so it's important to recognize that too. And, you know, obviously you should understand that it's scary for their parents, but also the team needs to understand that as well. The providers, the support system, and really have support there.
I think another thing about the idea of changing roles and shifting that responsibility is to not think of it necessarily as a closed door, but more as a revolving door. And I think in some situations, it's a role that can potentially go back and forth. I mean, I think everybody in this room, if there's something that is not your strong point, how many people here have ever asked somebody for help on something or making a decision? If you were going to buy a car or needed assistance with an auto repair, you would go to the mechanic and say, what would you do? And so I think the idea of informed decision making and having young adults be that person, but also recognizing that there are going to be times where other people may need to step in. You know, I've been in the hospital recently on my own, and by day 3, I was calling my mom saying, you know, what do I do? I've tried A, B, and C, and they're not listening. And, you know, it opened that door back up to say, I need some help. And that's okay. It's not, it doesn't always have to be a, okay, you're on your own, slam the door. There has to be that understanding of being able to go to somebody for advice and still get that level of support. And I think it's silly to think that every single one of us eventually are just never going to need help again. And I think understanding that idea of it is a flex, but empowering the young person to make those decisions as much as possible and still offering that support.
We do have a really cool video we want to show you, so we're going to kind of zip through these a little bit. But I wanted to give a quick summary. The 6 core elements that are promoted and supported through the National Center of GotTransition.org. This is basic. This is just really basic. What it boils down to is that for transition to be successful at a clinical level, there needs to be a policy. Somebody needs to know at what age are you going to transition out of a pediatric practice and into an adult practice. It shouldn't be a surprise, nor should it just be one person's responsibility. That's part of the open conversation. So whether it's age 18, 19, some practices are thinking 26 now because of the insurance changes. Let's just talk about it. So we know there should be a policy, and families should know what that policy is, and the clinical practice should talk about what that policy is. There should be a way to track and monitor the people in the clinic itself, how many people are going to be going through transition at any given time. And so that's something, again, that is just something that there should be a system in place at a clinical or, again, even at a hospital level. The big part that we talk about a lot is the readiness, and I think that's a handout that you guys have received now. It's the readiness checklist. The gottransition.org website offers a readiness checklist for parents and a readiness checklist for young adults. And it just is it's not an end-all be-all, but it opens the conversation. Like, wow, I've never really thought about that. So the checklist is a conversation starter, but it's a really good tool, and the provider and the young person should go through it together. Of course, the planning. What are we going to do? How do we find a provider? How do we find a specialist that will help with this particular condition? Or again, in my kiddo's case, where you know, it's things that I have to learn about the adult system. All her women's health issues are different now in the adult healthcare system. I filled out all the things I was supposed to fill out, and we still haven't found a primary care provider who's comfortable and willing to work with her. So the planning piece is a really big piece. Then there's a transfer of care where the practice actually says, okay, I'm the pediatrician and I'm giving you my kiddo, because pediatricians love and incubate our kids, and then they move into an adult system. In a family practice, sometimes it's just a shift of staff. Maybe it's the adolescent health team that's now moving in instead of the more pediatric young adult or early childhood team. And then the transfer is complete. Is there talk? Does the pediatrician and the new adult provider talk about making sure that everything is transferred well and that there are conditions? Sometimes they still do a consultation from time to time, and that's really important. So I know that was quick. The gottransition.org website has a plethora of information on all of this, and we hope that you will go to that as well. So in summary, before we go to the video, Teresa and Mal, do you want to make some other comments that will lead us into the video?
Sure. I think the biggest thing for us, and Teresa and I talk all the time about things in our lives, and you know, we do this for a living, basically. I've been involved in healthcare transition, as Eileen said, for about 8 years now, and I am, you know, we're both going to school for public health. We know, you know, all these things. We know, we are the experts, and still we struggle with transition, you know, in various ways. And we know when we're not receiving the best care. We know when visits don't go well. We know all of this, but that doesn't necessarily make it better. And I think, you know, for me specifically, going to work, being in school, having, you know, relationships and trying to prioritize the time I spend with people, I also really have to prioritize my health care. And what may be important to a certain provider is probably not high on my priority list if I'm feeling well. And well, we know that, oh, you need to see these providers, you need to do this, that, and the other thing. If it's not going to fit into my day, it's not going to happen unless there is a need that I identify. So I just think it's so important to remember that, even though, you know, for providers, it's so important and their system is the most important and this has to happen and that has to happen. You know, sometimes we get phone calls and we're like, yeah, not really a thing right now. I'll give you a call back when I'm having a problem, which, you know, sounds awful, but the reality is we just have a lot going on in our lives. And even for us who, you know, it seems that this is our life, it's our school, it's our day job, and like, oh yeah, I also like have to go to the doctor too and manage my own health, but with going to school for it and doing it for work, sometimes when I have a day off, the last thing I want to do is think about healthcare. And that's the truth.
And I just want to share a really quick conversation that I had recently with a specialist of mine. So I have brittle bones. I break bones very frequently, and I just had surgery in August, and I was talking to my ortho who has been seeing me since I was 2 years old. I'm 26. And so it's been a while, and you know, he was super excited about my master's program and da-da-da. And I said, okay, so you know my passion, and so do you have a doctor for me? I'm ready. I am so ready. I'm ready. The patient is ready. And you know, I'm asking for the transition, which is, I think, very backwards sometimes. But you know, he was very honest and he said, I'm not ready. And I cannot hand you off to somebody that I don't know. And that if they make your future goals go backwards, I cannot take responsibility for that. And so sometimes, you know, I mean, I know that we put a lot of pressure on providers and the healthcare system, And we do a lot of education around families and youth, and sometimes I think just the system isn't ready, you know? And so I'd like to make that.
That's a really good point. They just wanted to show off their boyfriends. Like, you just put a picture of us and Owen's in the room, and it's like.
Yeah. But you know, what I really like to get across, and specifically have been emphasizing recently, is that healthcare is not my life. It's not my hobby. It's not my interest. It's my job and my education, and also sometimes something I have to deal with. But the reality is, I am a student. I like to travel. I have interests. I have other things. I have relationships and family members, and it's, as I said, it's not at the top of the priority list. Obviously, when there are health needs, I address them, but truth be told, I address them when it's convenient for me. And sometimes that is not the way that other people think things should be handled, but it's a matter of, you know, taking time off from work and having special healthcare needs. You really that time off is sacred, because you never know when you're going to hit a medical crisis. And if I need to waste a day off to go see a provider and have someone be like, oh, looks good, bye. Like, I was talking to Teresa and I said, you know, if I have time during a day to go say, hey, how's it going? I want to go say, hey, how's it going to a friend, because I don't have enough time for that. And, you know, be able to spend time at home and enjoy, you know, quality time with my family and in my relationship. And it's not, we don't go to doctors for fun. I'm sorry, we don't. You know, we are up here going, yeah, healthcare, it's awesome. And it is awesome and it's important, but it's not who we are. And I think that is one thing that people just need to know. Even though we have special healthcare needs, as I said earlier, it's our diagnosis, it's not our identity.
And I think our lives, you know, the pictures with the boys and the vacations, I think it's a really beautiful demonstration of the reality and what can happen if a transition is going well, if the planning process is going well, if everybody in the entire involved team understands their role and what's supposed to happen. I think that's the whole point. It's to help, you know, people like us maintain our lives and achieve our goals and do things like not healthcare.
Right, that's true. And so for the parent perspective, and especially parenting a kiddo who requires a lot of care and will likely be living with me, we don't have group homes in our community, and I don't see her living independently anytime soon, and so it's a little different. You know, we have these conversations, and the reality is, even though these ladies can choose that, that's not reality for my family. And so I do have to continue to navigate the health and the healthcare system on behalf of Holly for many, many, many more years to come. And we know that there are gaps in services for the adults. When the kiddos graduate from the public education system at age 21, now what? Where do we go? What are the day programs? How do I pay for that? And what Medicaid waiver is going to help me support that? So these are the things that are really burdensome for many families, especially when you have a kiddo with developmental disabilities who are not able to navigate, or really strong chronic conditions that they're vent dependent, or for whatever reason they're really home based in a lot of ways. So want to make sure we balance that not every young person going through this system is as capable as these two young ladies are, and there are a lot of parents who are still waving the white flag like, oh my gosh, please help me. So our transition is not going well. Holly's been hospitalized. She continues to have 40 to 50 seizures a day. We have lots of issues that we deal with, and it's not going well. It's not going well in the healthcare realm. So let's get into the video. Do you want to do it while I'm setting that up? Teresa, you want to give a little intro?
So Dr. Right and Dr. Not Right are the videos that we'll be showing today. We'll be starting out with Dr. Not Right, which is obviously all of the things that could go wrong in a clinic visit while the transition conversation is happening. And we just I think it's important to keep in mind what went wrong and what should have happened. And
So pay attention to some of the 6 core elements. Mallory, Teresa, and myself, and some of the folks from the GOT transition, we wrote the script, we produced it, we did all of the pieces. We wanted to integrate the 6 core elements and the family and youth experience in video. So